Good evening, ladies and gentlemen, and welcome to tonight's debate. My name is Byron Taylor, and I'm the chairman, and Yura Sharma is the timekeeper. The adjudicator is Ms. Sabo. The topic of this debate is that the COVID-19 pandemic is worse than the virus. The affirmative team seated to my right is from Nazareth Catholic College. The negative team seated to my left is from Aberfoyle Park High School. The speaking time for this debate is 6 minutes. A single warning bell will sound 1 minute before the speaking time, and a double bell will sound at the speaking time. A continuous bell may be rung 30 seconds after the speaking time, in which case the speaker must sit down immediately. Please switch off your mobile phones and other electronic devices. I declare this debate open and call upon the first affirmative speaker, Oliver Reese.
Good evening, Mr. Chairman, ladies and gentlemen. The topic for our debate is that the cost of the COVID-19 pandemic is worse than the virus. We, the affirmative team, believe this statement to be unequivocally truthful. The Oxford Dictionary defines cost as the effort, loss, or damage that is involved in order to do or achieve something. It also defines worse as being of poorer quality or lower standard, more severe or unpleasant. The World Health Organization defines COVID-19 as an infectious disease caused by the SARS-CoV-2 virus and defines pandemic as the rapid spread of disease that has reached a very large scale, for instance, global. Today, as first speaker, I will be discussing my points in outlining our team's case. Our second speaker, Ben, will rebut the negative team's case and discuss his own points. And our third speaker, Colby, will rebut the negative team and summarize our team's case and individual points. My first point is the drastic decrease in employment and the crippled key economic areas that have been seen worldwide since the pandemics first began. Due to the restrictions and lockdowns put in place from COVID-19, businesses have seen a drastic loss in revenue, with the Australian Bureau of Statistics citing that 72% of businesses reported less income as a direct result of COVID lockdowns and restrictions. The Congressional Research Service has reported that the unemployment rate in the US alone, as of April 2020, reached 14.8%, the highest rate observed since data collection began in 1948. And the Australian Bureau of Statistics also cited that a total of around 870,000 people in this country lost their jobs after just a year of the virus's spread. Even my own father, who worked at Mitsubishi, an incredibly expansive and wealthy company, lost his job along with dozens of his colleagues only a few months into the pandemic. Staying inside can even have severe impacts on the virus itself, with obesity rates due to a lack of exercise during 2020 being cited by Trust for America's Health as at 42.4% among adults, the first time it has ever gone above 40% in the country's history. This, in conjunction with the British Medical Journal, citing that studies in the US have shown that having a BMI over 30, the threshold that defines obesity, increases the risk of being admitted to hospital with COVID-19 by an astounding 113%. This shows that even the restrictions of the pandemic have had severe impact on the deadliness and impact of the virus itself. However, the issue becomes even more severe. With the public making vastly less money, businesses will struggle even more to sell their goods and services, in turn causing more people to lose their jobs, which repeats the process again and again. This snowball effect has been having massive impacts worldwide and has caused several large businesses to file for bankruptcy, including Belk, a massive American department store chain established in 1888. That is a business that has stood successful for over a century, destroyed by the pandemic. Other large businesses that went bankrupt include Guitar Center, Century 21 stores, Chuck E. Cheese, the Brooks Brothers. All of them were stable and consistent businesses that started in the last century, and now all of them are gone. My second point is the change in lifestyle experienced by every last one of the 7.9 billion people in the world over the last year. The inability to leave our homes, to live life as we always have, is something neither you nor I would ever have dreamt of before. And yet today, we face it as normalcy. It has become commonplace to make every effort to distance yourself from the people you love, to avoid being social, to avoid conveniences as general and as simple as going to the shops. The costs of the coronavirus pandemic, monetary or otherwise, have been devastating and incredibly widespread for the better part of the last 2 years. The disease itself can be severe and deadly, but when compared to the global mandated restrictions implemented by governments everywhere and their impacts on our livelihoods and our well-beings, its impact is far less significant. Thank you.
I call upon the first negative speaker, Lachlan McKeon.
Good evening, ladies, gentlemen, Mr. Chairman, and Timekeeper. Tonight's debate concerns the argument that the cost of the COVID-19 pandemic is worse than the virus. We, on the negative team, do not agree with the given topic and believe that the cost of the virus is worse than the cost of the pandemic. We also agree with the definition proposed by the affirmative team. As the negative team, tonight as the first speaker, I will be discussing 2 points regarding the pricelessness of human lives, personal, financial, and mental costs caused by the virus. Then, our second speaker, Mariko, will argue that it is the mutations of the virus, not how it spreads, that leads to increased healthcare costs and deaths. Then, our third speaker, Libby, will rebut and sum up our team's case. Prior to this, however, I will rebut the opposition's argument. The first affirmative speaker has incorrectly tried to tell you that due to lockdowns, many businesses have had to close, masses of people have lost their income and were unable to provide for themselves and their family. This is incorrect, because if you ask any person out there about whether they would rather lose their jobs or a family member, I could say with certainty they will not choose the latter. Now, on to my first point, which concerns the value of human lives. It would be ignorant to divert our attention from the pricelessness of a human life. Each individual who was subject to the virus not only was an economic factor in our community, but also a sentient being with significant connections with their surrounding family, friends, and peers. The death of an individual due to COVID-19 not only brings a decline in the person's socioeconomic class, especially if they are a working class individual, but also brings despondency, tension, and worry upon the minds of the people they knew. The loss of friends and loved ones has had an extraordinary effect on the state of the mental health of the population. According to an early 2021 report by the Kaiser Family Foundation, the proportion of US adults who report symptoms of depression or anxiety has averaged approximately 40% since April 2020, which is drastically more immense than the comparable figure in early 2019, which was only 11%. This data translates to an estimated 80 million additional people developing mental health conditions because of the COVID-19 virus. If, in line with the prevailing estimates, the cost of these conditions is valued at about $20,000 per person per year. And if the mental health symptoms last for only 1 year, the value of these losses could reach approximately $1.6 trillion. According to the US Department of Health and Human Services, the US Environmental Protection Agency, the US Department of Transportation, hundreds of other organizations, there is a concept called VSL, otherwise known as Value per Statistical Life, which estimates that each life is worth approximately $10 million. With a more conservative value of $7 million per life, the economic cost of premature deaths expected through the rest of this year is estimated at $4.4 trillion. Secondly, the virus has been the catalyst and the cause of multiple financial, mental costs, and burdens upon individuals. A primary reason for this is that economic recessions feed on themselves. Workers aren't earning money, won't spend money, and so other businesses' profits decline. The federal government has offset much of the initial loss owing to the shutdown, which has averted what would likely have been a new Great Depression. But the virus is ongoing, so full economic recovery, according to the Economic Times, is not expected until sometime next decade. The Congressional Budget Office projects a total of $7.6 trillion in lost output during the next decade in the US. Even worse, individuals that survive COVID-19 are likely to have significant long-term complications, including respiratory, cardiac, and mental health disorders, and may have an increased risk of premature death. So in conclusion, ladies and gentlemen, on account of our arguments, it is evident that the cost of the COVID-19 virus is a large figure that clearly surpasses the cost of the pandemic. Thank you.
I call upon the second affirmative speaker, Benino.
Good afternoon, Mr. Chairman, ladies and gentlemen. The topic of the debate is that the cost of the COVID-19 pandemic is worse than the virus itself. We, the affirmative team, believe that this statement is true. The first negative speaker has tried to tell you that 40% of people in the US got psychological distress because of COVID. This is correct, but that is not his argument. His argument is the cost of the virus, but he labelled statistics from the cost of the pandemic itself, not necessarily of the virus. He also said many of his main points during his argument were of the cost of the pandemic, not of the virus. Today I'll be talking to you about 2 points. My first point being that the mental health impacts of COVID restrictions and lockdowns. My first point is that the mental health impacts of COVID restrictions and lockdowns. And my second point is that the impact of the pandemic on students, especially those who graduated last year. My first point tonight is the mental health impacts of people in lockdown, namely the increased rates of suicide due to lockdown. Suicide is a major social issue that has taken the lives and souls of over 700,000 people every year. Due to the lockdown and lack of social contact, a study by the Journal of Psychiatric Research found that almost 1 in 10 Victorians had seriously considered committing suicide during the lockdowns of 2020 and 2021. With young people, unpaid carers, and people with a disability found being most at risk of suicide. In another study by Suicide Prevention Australia, found that 15% of Australians directly knew of people that had committed suicide, and another 11% that knew them indirectly. Young people have been affected the most due to lockdown, with over 30% of 15 to 19-year-olds surveyed in 2020 by Mission Australia had some sort of psychological distress, and 1 in 3 of those youngsters thinking about suicide regularly. COVID-19 is contributing or exacerbating long-term mental illnesses such as depression and PTSD, according to the Australian Institute of Health and Wellbeing. Mental health is a major issue in today's society, especially in the middle of a pandemic where people are isolated from each other and have an injury unseen to those around them. My second point today is that COVID-19 has a major impact on the quality of education that we as students are receiving during the pandemic. COVID has forced us as students to learn online and use such programs such as Teams and Zoom. The troubles that students have had being taught on these sites are horrendous and should not continue, as the education that we're receiving is not as good as the ones we're receiving in face-to-face learning. Year 12s, as of last year, are the most affected by online schooling, as they are missing vital education and resources that they need in order to complete their education. According to the ABC, many students are worried that they do not know what they need to know in order to prepare for their final exams that are worth a major part of their ATAR. Over 70% of students believe that the COVID-19 pandemic has negatively affected their schooling in the last 2 years. Children of New South Wales have been restricted from face-to-face learning this year for over 2 months. And for another 2 months, they will continue, and only coming back into face-to-face learning in late October. This is a major risk to the learning of those students, giving them a disadvantage in the workplace and in their future education. The impact of students in the pandemic is terrible and will affect many of these students for an undetermined period of time. Mr. Chairman, ladies and gentlemen, in conclusion, the cost of the COVID-19 pandemic is unequivocally worse than the virus itself, and will majorly impact the mental health and education of people and students. Thank you.
I call upon the second negative speaker, Mariko Woodley.
Good evening, ladies, gentlemen, chairman and timekeeper. As mentioned previously, the topic of discussion for this evening's debate is that the cost of the COVID-19 pandemic is worse than the virus. We absolutely disagree with this statement. Tonight, as a second negative speaker, I'll be talking to you about my 2 points. Before I say my points, I'll rebut some of the affirmative team's cases. The first affirmative speaker has tried to tell you that the economic and job loss is worse than the cost of lives, which is ultimately the cost of the virus, and that lockdowns increase obesity rate. The point of jobs and economic losses suggests that the cost of losing jobs and money because of the lockdowns and restrictions of the pandemic is worse than the loss of life, which is the ultimate cost. The cost of lives is not as worse. They have said that the cost of lives is not as worse than the cost of income, jobs, money because of restrictions. They have stated that the lockdowns have increased obesity rate, this is completely incorrect, because in Australia, particularly our lockdowns restrictions enabled us to exercise within 5 kilometres of our house with family member or even a close friend in final lockdown stages. Supermarkets were also open when restaurants and fast food outlets were closed, enabling us to purchase healthy foods. Furthermore, 70% of obesity and related health issues can be attributed to diet and not exercise, completely disproving the given argument. Now I'll go to my points. Firstly, I'll discuss the importance of the virus's mutation rate and how this makes it more expensive than the pandemic, because as the mutation rate increases, the chance that the virus will mutate into a more dangerous and deadly variant increases. When the COVID-19 spread all over the globe last year, scientists wondered how deadly the virus behind the pandemic might be changing as it was passed from person to person. The gene encoding the spike protein, which helps virus particles to penetrate cells, is the reason why the virus is so effective at infecting humans. As stated by the books on medical microbiology, at the 614th amino acid position of the spike protein, the amino acid aspartate was regularly being replaced by glycine because of a copying fault that altered a single nucleotide in the virus's 29,903-letter RNA code. Virologists call it the D614G mutation. For the D614 variant, the propagation of 96 lines resulted in the accumulation of 1,753 novel mutations. By conducting a series of simulation experiments, the scientists observed a significant variation in the rate of mutation accumulation among the viral genome. Furthermore, they noticed that among different genomic regions of the D614 variant, the spike gene has the highest rate of mutation accumulation. For the D614 variant, they observed that the spike mutation rate is almost 5-fold higher than the average genome. When the mutation rate increases, it is inexplicably difficult to protect a large population from the virus due to the unpredictability of the virus. This means that the mutation in the COVID-19 virus is not only fatal to the human population, but it will also cost a considerably high amount of money to develop and produce any sort of cure to the coronavirus. Now I'll move on to my second point, which focuses on the makeup of the coronavirus and how that has enabled it to take such a big effect on people's lives. According to PubMed, at the molecular level, coronaviruses employ a variety of unusual strategies to accomplish a complex program of gene expression. Coronavirus replication entails ribosome frame shifting during genomic translation, the synthesis of both genomic and multiple subgenomic RNA species, and the assembly of progeny virions by a pathway that is unique among enveloped RNA viruses. One important characteristic of viruses and other pathogens is how contagious they are. This is measured in a few ways. Notably, the key measure is the RO, or the basic reproduction number, which indicates how many new cases one infected person generates. This is a measure of the inherent infectiousness of a disease, the rate of contact within a population, and the duration of the infectious period. Early studies of the behavior of the COVID-19, the average RO was estimated to be between 2.2 and 2.7. Other studies suggest that values as low as 1.5 and as high as 3.8 are possible. However, with the new Delta variant, has an RO of 6, which according to The Guardian is 3 RO higher than the Spanish flu and 4 RO higher than Ebola. This indicates that the composition of the virus, namely the infection rate, is proof that the virus is so costly to human life that no amount in the economy could ever compare to the permanent damage inflicted on life. In conclusion, ladies, gentlemen, timekeeper, due to the evidence put forth, the cost of the virus COVID-19 is worse than the cost of the COVID-19 pandemic. Thank you.
I call upon the third affirmative speaker, Colby Thomas.
Good evening, Mr. Chairperson, ladies and gentlemen. The topic for our debate is that the cost of the COVID-19 pandemic is worse than the virus itself. We, as the affirmative team, believe this statement is absolutely true. As the third affirmative speaker, I will be summarizing my team's case, and I will also be rebutting some of the points proposed by the opposition. The first negative speaker claimed that the coronavirus did in fact not cause people to lose their jobs and that it was a choice. Those in low-income areas cannot afford to not work and are willing to take a risk to support their family, and yet they were forced out of work without any say of their own. It is also worth mentioning that while 1,053 people in Australia lost their lives due to the coronavirus, 870,000 lost their jobs. The numbers are almost not comparable. He also tried to tell you that the monetary losses were irrelevant due to government handouts. Money, as I'm sure you're aware, simply cannot just appear out of thin air, else the economy here would end up like how it is in Venezuela, where the government, in order to fix debts that it had, repeatedly printed money until their currency was not worth the paper that it was on. While the economic impact on the citizens may have been softened, the debt will simply not go away and will merely just be passed on to the government or some other entity. Their second speaker has tried to tell you that the obesity rate statistics that my colleague Oliver provided were false, which is a straight-up lie. Not to mention that the statistics Oliver raised were from America, not Australia. We are discussing the effect of the virus worldwide, not just in the country that we live in. She also said that the governments are in debt, and while this is true, the governments are not in debt because of the vaccines that they've been producing, like they mentioned. I would also like to say that we are discussing a comparison between the deadliness of the virus and the cost of it on a wider scale, not denying that the virus itself is a danger. On to summarise my team's case. Our first speaker, Oliver Reese, has gone over the increased unemployment rates caused by the pandemic. Innumerable amounts of people have lost their jobs, and those that were never employed have struggled even more than usual to change that fact. Multitudes of stable, successful businesses have fallen to the wrath of the virus, and those that worked there have been left jobless. Even businesses that have managed to stay afloat during these trying times have had to either reduce hours or cut staff altogether. Oliver also mentioned that although not everyone has caught COVID-19, everyone has been drastically affected by it and had their day-to-day lives changed immeasurably. Not to mention that due to the volatility of the virus, any freedoms that we may experience could be taken away from us at any moment by a snap lockdown as a result of an outbreak none of us have any control over. Simply the sheer mental toll of having to distance oneself from those they love every single day and expected to just treat that as the norm has had an effect on everyone. Which leads on to our second speaker, Benjamin Benino's points. The lockdowns and simply the constant threat of having a virus possibly at your doorstep has been a major detriment to everyone's mental health, whether they would like to admit it or not. While some people have definitely done worse in lockdown than others, it has been harmful to us all. According to ABC News, over 12% of the Victorian population had started or increased using substances to deal with their emotions during the extensive lockdowns the citizens of Victoria suffered through last year. Needless to say, this is a major issue and has undoubtedly caused suffering and hardship for those that struggled. Benjamin also brought up that the students that are required to stay home from school and work remotely during lockdown have received significantly lesser quality teaching than if they were actually in class. While the teachers are trying their best, they simply cannot do everything. This is of course going to affect them most likely for the rest of their lives and is giving them inadequate education when compared to the rest of the population. So, Mr. Chairperson, ladies and gentlemen, to conclude, the cost of the COVID-19 pandemic is undoubtedly worse than the virus itself because of the points laid out by the rest of my team. And all I would like to say is stay safe and wear your masks. Thank you.
I call upon the third negative speaker, Libby Chase.
Good evening, ladies, gentlemen, Mr. Chairman and timekeeper. As previously established, the topic for contention for tonight's debate is that the cost of the COVID-19 pandemic is worse than the virus, and here on the negative team, we firmly disagree with this proposal. To begin with, I will disprove the immensely flawed and irrelevant arguments put forward by the affirmative team, followed by a summary of my team's case. To begin with, the affirmative team has repeatedly brought up that the mass quarantine imposed by governments to control the spread caused an increase in mental illness and suicide. However, there is a key distinction that the affirmative team has failed to address in this point, being that the consequences of the pandemic include the lockdown, but the implications of the lockdown are not the fault of the virus spreading or the pandemic. People are not committing suicide over a virus spreading, they're becoming suicidal because of the lack of resources they have to cope with the isolation, something that could have been handled by the government or by mental health institutions. This has nothing to do with the pandemic itself. To continue, many of the statistics around suicide deaths and lockdowns are incredibly misleading. An example of this is statistics from the Coroner's Court of Victoria being warped and utilised as an argument against lockdowns. It was stated that in the first 5 months of 2021, there were 0 coronavirus deaths and 276 suicides. However, this 276 figure was less than the previous year and the same as years before that, even prior to COVID existing, proving that lockdown had little impact on suicide rates and that there must be other factors in cities or countries where it did impact, like failed mental health institutions. Furthermore, more people died from COVID than suicide because of COVID. So clearly the virus itself is of far more impact. The affirmative team also stated that we, the negative team, said that the loss of jobs was a choice and that the government handouts solved this issue. This is entirely fabricated and this point was never actually raised by us. The affirmative team has also brought up repeatedly that at-home learning was detrimental to students and their educations. However, for many of us, at-home learning provided a learning experience and led many of us to develop our self-responsibility and time management skills. In a classroom at school, teachers manage your time for you, but when you're an adult, it isn't like that. So when we had to learn at home and do our assignments on our own, we had to manage our own time, which is much more like being an adult, something that all of us are going to have. We're all going to have jobs. Home learning also suspended physical bullying entirely, and all of the students that were like in a bad environment at school and getting bullied by people, they weren't getting bullied anymore because they couldn't see their classmates in real life. As for the students with final exams, it remained a level playing field as all students are in the same situation. To continue, lessons were still taught via Zoom and WebEx, and whether or not students applied themselves remained a matter of personal responsibility. Many students thrived in home learning, and those who did not most likely just simply didn't apply themselves. This is not a direct result of the act of the coronavirus pandemic spreading. The affirmative team also stated that the businesses were falling at the wrath of the virus, but this is an argument for our team, so I'm not really sure why this was brought up, and as it is a complete contradiction and supports what we have stated. The affirmative team also brought up that drug use increased in lockdown. However, in lockdown, the idea of lockdown is that you can't leave your house, so where are these people exactly getting the substances from? And if they did have some at home, they would have run out. Furthermore, parties and gatherings were not held, so places where this drug use would have take place didn't actually happen. To conclude, the first speaker representing the negative team, Lachlan, discussed 2 critical points. The first being the value of the human life and how the knock-on effect of grief and loss has impacted so many people across the globe, inflicting not only an economic but an emotional and physical loss. He further discussed the long-term psychological, physical and economic impacts of COVID-19 and how this outweighs the short-term loss caused by the pandemic itself. To continue, the second speaker representing the negative team, Mariko, firstly covered the likelihood of COVID-19 mutating into a deadlier virus, more difficult for us to control with a far more unpredictable spread. She then argued the genetic makeup of the coronavirus and how it is different to other RNA viruses due to the complex structure, how contagious the virus is, and quite how many people can contract it from a singular person is unknown. Evidently, the arguments presented by us, the negative team, throughout the course of tonight's debate conclusively prove that the pandemic is in fact not worse than the virus itself. Thank you.
now come to question time. For the next 3 minutes, teams are invited to take turns to ask each other questions about the debate. That is, the affirmative team will ask a question, then the negative team, then the affirmative team, and so on. The team is free to indicate if it has no questions. I now invite the affirmative team to ask its first question.
This isn't really a question, but I did find it interesting that you decided to rebut a statistic we had from ABC News with just like a snarky comment like, where are they getting the drugs from anyway? That's not really a question, I just thought that was interesting.
I will remind you that it's question time, so if you're going to say something, it does need to be phrased as a question.
Okay, sorry.
Did you guys have trouble finding points that were, and like the points that you did find, statistics and things like that? Did you have trouble, categorizing it as an impact of the virus or an impact of the pandemic, as we had trouble with that?
I mean, yeah, we did. With the first negative speaker, that we had that Lachlan, we kind of had that trouble. But yeah, with my points, I feel like that wasn't really a problem since we just talked about how the virus is made up and like not like made up, but like how it is made up, like literally. And that wasn't too hard, but yeah, we did have trouble with that.
When the third negative speaker was speaking about suicide.
You better take turns. Take turns when I said that. Let's ask the question.
We don't have any questions.
There you go.
When you're the third negative speaker, where'd you get your stats from about suicide?
It was like it was a thing on the news in Victoria. It was like they were saying how there was lots of and how there was like lots of suicide deaths during the lockdown, and there was 0 coronavirus deaths. Like the amount of suicide was like the same as usable, and it was from the Victorian like coroner's court of like how many people died from what cause.
Was that worldwide?
No, that was like
Suicide
in
deaths
Victoria.
or
So I know that you guys
Victoria?
brought up a
Okay.
statistic
Yeah,
in Victoria as well.
I brought one from worldwide and of Victoria.
Anyone else have any more questions?
No.
That's a
Yeah,
shame.
any questions?
Come on, Colby, surely you've got something. I guess that's
hard work being chairman.
Oh, it is. It's so boring.
Do you have a question, Chairman?
No. I get them? No, anything to ask?
No.
There should be another bit on the sheet for you.
Oh, is
to
it?
read.
Right, yeah. While the adjudicator finalises the results, I will read this evening's chairman's notices. Okay. Quarterfinals Chairman's Notices 2021. We are delighted to announce that subject to COVID restrictions, the grand finals will be held in the House of Assembly Chamber, Parliament House, on Saturday 25th of September 2021. There will likely be a need to RSVP for contact tracing purposes, so please keep an eye out for this information. Year 10 and senior debaters can apply to adjudicate primary school debates in 2022, and they can see the information desk for information on how to sign up. Topic and site information for the semi-finals will be available on the Debating SA website from tomorrow morning. Please be sure to check your side and debate time information carefully. Debates will be held here at the same venue next week. That is all.
Date, Lauren? What was the date of the GM?
Of the grand final?
Yeah.
25th of this month.
That's what I just looked at.
Like, what time is it?
I think it's 6 in the morning. Broadcast on Facebook. It's a non-credit file. Maybe it's lunch.
I now invite the adjudicator, Ms. Sabo, forward.
I'm going to start by offering my congratulations to both teams, and can we give them both a round of applause? I am going to give some individual feedback to the speakers before I announce the result of the debate this evening, and we'll start with the first affirmative speaker, Oliver. It was really good to see you providing clear definitions of the key terms of the topic, but what we really needed to see from your team tonight was an interpretation of what the topic as a whole meant. That was quite key to the debate. We needed things like bounds and whether we were talking about the world as a whole or in Australia. We also needed to make it clear that this was a comparative topic. You guys were basically arguing, or supposed to be arguing, that the response to the virus was worse than the virus itself, whereas the opposition was arguing that the virus was worse than the response. And that sort of became clear as the debate went on, but it was not clear initially, and it really needed to be made clear in your definition. I also thought you needed to be really careful that you weren't appealing to emotion in your arguments. That's what we classify as a logical fallacy, particularly when you were talking about your anecdote. It's okay to have anecdotes, but it's not okay to have that in place of evidence when you're speaking. And also you need to be really careful in your point about obesity. Correlation does not imply causation, and you needed to expand on your evidence for that point to ensure that you weren't at risk from a slippery slope argument, something that the opposition unfortunately picked up. I thought you presented quite well though. We could hear you quite clearly, which was excellent to see. Congratulations. Moving on to the second negative speaker, Lachlan. Your rebuttal was not effective because it didn't actually address the point that your opposition had raised. It was great to see you listening to the point, but when you stand up, you can't just sidetrack the issue. You actually need to deal with what they've said, and I don't think you did that very well tonight. You also need to be careful you don't appeal to emotion in place of facts in your rebuttal in particular. You also needed to make your link between mental health stuff and the virus clearer. I wasn't actually sure whether that was on topic for you, your team, given that you were supposed to be arguing that the actual virus itself is worse than the response. So if you could have expanded on that a little bit more, that would have been good. And you also need to be a little bit careful you don't read off your cards. I thought you had a really good presence when you were speaking tonight. That was excellent to see, but a little bit more engagement with the audience would have been great. Debating is not just standing up and regurgitating an essay you've written down. It's a spoken art form, and part of your job is to engage with your audience. That's part of the way that you convince people. But you did speak well tonight. Congratulations. Second native speaker, Ben. It was a very good pick-up in your rebuttal about the irrelevancy of the first point that the opposition raised, but you do need to explain why in a little bit more detail. It was really good to see that you picked it up, but it would have really strengthened the point if you'd explained and expanded on it a little bit more. And this is part of the reason why we needed a clearer definition for this debate this evening. You again need to avoid emotion and emotively based arguments. So sometimes when you speak with debating, it's very tempting to use high modality words or to use words like terrible, which are designed to invoke an emotional response from the audience. This is not a good way to argue because it's not actually supporting the argument. It's just trying to manipulate your audience, if that makes sense, rather than providing facts to support your argument. You needed to also make sure that you were talking about the impact of lockdowns and not the impact of virus. I wasn't sure about that in a few of your points. Also remember, correlation doesn't imply causation. In terms of your presentation, we could hear you really clearly, which was great. I thought you could have been a bit more fluent with your presentation. I know that's not easy when you're up the front talking like this. What I'd recommend students to do is to read your speech through a few times before you go to bed, because your brain will actually process what you're saying overnight, and you'll find that you stand up the next day and it's so much easier to speak it really fluently. But you spoke very well tonight, congratulations. The second native speaker, Mariko. I thought your rebuttal was great. You could have, in the point about the obesity, it was really good to see the way you rebutted that. You could have talked about correlation and causation, and that would have strengthened your rebuttal further in the second point. You did need to make sure your first point was actually rebuttal, not just summarising what they'd said. I thought it was helpful that we had the summary at that point because I wasn't quite clear. It helped stabilise the debate for me. But you do, part of your role in as a speaker in that part of your speech is to rebut. So just stating what they've said is not enough. You do actually need to attack the point as well. That being said, it was really good to see you listening so closely to the opposition. Well done. Make sure your first point is relevant to the topic as well. You need to explain why the mutation means that the virus is worse than the response to the virus, and needed to make that a little bit clearer. And just be careful not to read off your cards, but you spoke very well tonight. Congratulations. The third affirmative speaker, Colby. You do need to listen very carefully to the opposition's points. At least 2 points of your rebuttal I wasn't sure the opposition actually raised, and they did refer to that when their third speaker got up to speak. Again, careful not to appeal to emotion. It's very easy with COVID, something that a lot of people have very strong opinions about, to try and appeal to emotion, but we need to resist that as debaters. It was a really good attempt at your counter rebuttal regarding the obesity point. I thought that was very cleverly done. Congratulations. You also need to make sure rebuttal is about attacking the key points your opposition raised, not quibbling over small facts. So really try, when I'm trying to help students get better at rebuttal, your first step is to write down your opposition's key points. What are the key things that they've argued, and what are the key facts and statistics or the key reasoning that they've used to argue that point? Then you look for flaws in that on those key points and in those in that key reasoning. So if, for instance, there's a problem with a fact that they've relied on all the way through, or statistic they've relied on all the way through their argument, yes, attack it. But sometimes I felt some of the points you were bringing up were quite trivial and didn't really undermine their case as well as they could have. You also need to be really careful you don't read off your cards, but you have an excellent summary, and well done tonight. Libby, last but not least. You had some really, really good rebuttal. It was really helpful and it was really effective. Congratulations. Your summary was really good. You were a little bit short on time, I think, too. And I think you probably could have had a little bit more depth in your rebuttal. I know it's difficult when they pick up points and you're like, oh, I've addressed all of those. But debating essay advises a 70-30 split for third speakers with rebuttal, which in practice normally means you're rebutting up to the first bell. We have an excellent timekeeper that was doing a great job with the bell. So just make sure that you keep rebutting until you hear that bell and then you go, right, it's time to move on to my summary now. Another option is to have, when you write your summary, I often bracket sentences that I can leave out if I've got too much rebuttal, but then I can put them in if I'm running a bit short on time. That might be something to consider for next time. But I thought you spoke excellently this evening. Congratulations. All right, now the bit you've all been waiting for, the result. I'll preface this by saying the debate this evening was very close. It was within 0.3 of a point. And unfortunately for me, I have to make difficult decisions sometimes because we can't have teams tied. But I am going to award it to the negative team this evening because I thought their rebuttal was slightly stronger. Congratulations.
I call upon a member of the runner-up team to give a vote of thanks.
like to thank the audience for coming in tonight. I'd like to thank my team for putting up a great debate. I'd like to thank the chairman for hosting it, the adjudicator, timekeeper, and of course the opposition.
I call upon a member of the winning team to second that vote of thanks.
I'd like to first thank the place for Nazareth for hosting the place, and I'd also like to thank the opposition for providing an excellent debate. I'd like to thank the chairman and timekeeper for regulating this debate very well, and also the audience for coming and watching us do the debate, and also the adjudicator for providing results and individual feedback. Thank you.
Ladies and gentlemen, thank you for your attendance. I now declare this debate closed.